There we go. Yes, keep the pets safe. It is chilly out there.
Yeah, chilly, kind of an understatement there. It kind of even makes you stutter a little bit too. Pardon me there, couldn't spit it out. But yeah, either way, you get the idea. It's cold.
We don't have to chase the dogs because they don't want to be out in it. So they come right back in.
Yeah, definitely.
But you can tell a lot this morning. We're going to be talking about the tongue as an indicator of your health. And Nurse Christina is joining us this morning. Thanks for coming on in. So what can you tell us about the color of our tongue relating to our health?
Sure. So the tongue has a lot of, it does a lot of things. It helps us to chew food. It helps us to taste food. And there's certain areas of the tongue that are responsible for certain different things that we taste, like salty foods or spicy foods or sweets. And there's also these little glands, taste buds, we call them on the top of the tongue, and those can get infected too. Oh. But something else you can look at is the color of your tongue. Now, I want to say this is somewhat entertainment, somewhat educational. Please do not take this as a diagnosis, but certainly something to look into if you notice this. So the different colors of the tongue, a normal healthy tongue is pink.
Okay.
So when you look at your tongue, it's pink. If your tongue is red, that could indicate a iron B deficiency. It could be different, you could have different illnesses. It can also indicate allergic reactions. And so you want to watch for that. If your tongue is purple, purple can indicate poor blood circulation, a heart condition. A tongue that is blue, blue can indicate a lack of oxygen or eczema. So you want to watch for that. A yellow tongue can be bacterial growth. Poor oral hygiene could indicate jaundice, which is a liver disorder, or it's like an effect of a liver disorder.
I know sometimes, you know, like right before you like brush your teeth and use mouthwash and stuff, you might notice your tongue's like a little bit of a whiter color. Then after you brush teeth and use mouthwash, it's kind of not as white. That's
just, I think the saliva and things that kind of accrue in our mouth overnight, sometimes our sinuses drain and it can kind of get in there and get crusty, especially for those who are mouth breathers or those who use CPAP machines. A lot of CPAP machines have moisture that is added in, so that can sometimes help too.
Yeah, definitely. I mean, you know what, I think it's safe for me to say this too. CPAP machines, you were looking at me there. I will be getting one because I actually did get a sleep apnea diagnosis, so this will be an all new educational experience for me.
Yep, and you'll want to keep that oral health really good.
All right.
Definitely.
So besides just the colors, there are other signs we should be looking out for.
Right. So, yep, you want to make sure, you know, that, like I said, the shape of your tongue, if it's thin, could indicate that maybe you've got some low volume as far as like fluid buildup. You also can look at the coating. So like you were saying, a white coating. Now if you, not just when you wake up, but if you have a white coating or your tongue is white, that could indicate thrush, which is a fungal infection. People who use inhalers will often get that because of just the buildup. Can also indicate things with your bladder, stomach, intestines, problems with that. And then moisture, of course, you know, you want to make sure that your mouth is good and moist. That helps protect your teeth as well as your tongue, helps you digest food, break down food, so.
Yeah, certainly a good start to some tips there. Anything else we should be on the lookout for to keep a healthy mouth?
Absolutely. You want to make sure that the oral health overall. So you want to make sure you're brushing your teeth at least twice a day with toothpaste that contain fluoride. You want to make sure you're eating healthy foods, especially foods low in sugars. And if you like foods like, well, it's not even food, but candy, like those Sour Patch Kids, those can be really hard on your teeth because they've got that acid. That's what makes it sour.
How about just drinking a good amount of water, too?
You can follow that up with water. Yep, especially, or if you're drinking sodas, things like that, you want to kind of rinse your mouth out with water after that. Cleaning your teeth every day. Making sure you visit your dentist regularly. It says avoid tongue and lip piercings. I mean, you just want to watch out for infection with those. And tobacco products too. You want to try to stay away from those. And I did look, the Department of Aging and the Wisconsin Department of Health have a whole bunch of places that you can go if you don't have dental insurance. So there are a lot of places up here that offer free or low-cost dental care. So it's really important if you are having dental problems, go to the Department of Health website and find a dentist near you that can at least, you know, do a checkup, maybe help just get your teeth back on track, because it's important, you know, if we don't have teeth, you can't eat. It makes eating difficult. It makes talking difficult. So there are options in our area. You just want to do a little research.
You think of like when you're a kid and you lose like your 2 front teeth or something like that, and you're like thinking your tongue out like crazy.
You can't, yep, it does. It affects your speaking for sure.
Well, absolutely. Well, thanks again for coming on in. I appreciate us. You know, you never really think about maybe the tongue quite as often when you think about some health problems.
Yeah, unless you're speaking in tongues from the Bible.
Yeah,
there you go.
And that's a whole nother, takes it to a whole nother level.
That's a whole nother topic.
But thanks again for coming on in. Always appreciate you just helping us out a little bit health-wise each week.
Absolutely.
All right, but coming up, we have what's trending, including a fresh new look at what might not be quite so